Dr. Ruiz Online uses reasonable care in selecting and providing content that is both useful and accurate. Dr. Ruiz Online does not represent, however, that the instructional materials are error-free or that the content or materials are comprehensive. Any opinions expressed in the materials are those solely of Dr. Ruiz and not necessarily shared by the entire dental profession. By viewing this video, you have read and accepted the legal disclaimer, including the rules and regulations that you agreed to during registration.
Welcome to Dr. Ruiz Online. My name is Dr. Jose Luis Ruiz, and today's subject is occlusal disease, the silent enemy, how to spot it. And this is video 301. This subject is very interesting because truly occlusal disease is a silent enemy, because we see the effects of occlusal disease every day in our practice. Our patients suffer from the consequences of occlusal disease, the pain, the destruction of their teeth, the discomfort, and they're not even aware that this is caused by occlusal disease. So it truly is a silent killer. So for a dentist, when is occlusion important? And the answer is, it's important most of the time. It's important when we are considering to do extensive dentistry. It's important when we are considered to do dentistry on patients who have tremendous amount of wear and signs and symptoms of occlusal disease. Because occlusal disease is the #1 enemy of our teeth and the #1 enemy of our restorations. There is no doubt that the #1 reason why our restorations fail, whether it is because of fracture, breaking, or even post-op sensitivity, is due to occlusal disease. So it is indispensable for us to manage this problem and to educate our patients so they are aware that they have this condition. So how big of an enemy is occlusal disease? Well, this picture right here in front of us really tells a big story. Look at the patient to your left, and you will realize that that patient and the patient to the right are the same age. Now, why is it that the patient to the right has teeth that are so badly destroyed? And the answer is because the patient to the right has occlusal disease, a very aggressive type of occlusal disease. All of the damage in this patient is caused by his occlusion. His periodontal condition is very healthy. He doesn't have rampant caries. But if you keep looking closely at his teeth, you will notice deep abfractions. You will notice incredible amount of wear on his teeth. You will notice the teeth are missing, and when you ask him, he said that the reason was because his teeth were soft. He kept fracturing them. And do you think that his teeth were soft? Or is it that he had occlusal trauma and that caused fractures on the teeth? No question about it. The reason was occlusal disease. So it is an incredible enemy for our patients and for our patients' teeth. And we can see that story time and time again. We can see patients like the patient to the left with pretty healthy teeth at age 40 and a patient to the right at age 40 with incredible amount of destruction caused by occlusal disease. And certainly we can see patients who at age 50 and 60 and even more, they have dentitions, they look healthy and beautiful. So then we could ask ourselves the question, what is occlusal disease? Is it really a disease? And the definition of the American Heritage Dictionary is that a disease is an abnormal condition of an organism as a consequence of infection, inherent weakness, or environmental stress that impairs normal physiological function. And there's no doubt that occlusal disease fulfills the requirements to be a disease because it is an abnormal condition, it's pathological, and it causes dysfunction. It causes an impairs normal function. And as you can see in this picture, it causes incredible amount of damage, and our patients suffer a tremendous amount due to this occlusal disease. So, to be more specific, occlusal disease is a genetic term denoting any destructive process evident in any part of the masticatory system, whether it's the joint, the muscles, the periodontium, or the teeth, as a consequence of occlusal disharmony of parafunction. So, occlusal disease has many phases, but it's always destructive, and it always is a consequence of occlusal disharmony and parafunction. And the next question is, why is it so important then for us to treat occlusal disease? And the answer is that every single dentist, everything we do affects occlusion, and occlusion affects everything that we do. If we only treated occlusal disease routinely in all of our patients and manage occlusion, at least half of all of our problems will go away. Problems with fracture restorations, problems with patients having post-op sensitivity or even developing some type of facial pain, all of that will go away if we handle occlusion properly. Also, we will really improve the quality of life of our patients. We will give them a much healthier dentition. The signs and symptoms of occlusal disease sometimes can be debilitating. And finally, also by treating occlusal disease, we are also opening up an untapped generator of production, because there's a lot of patients with occlusal disease that need treatment for that. And there is not a better way to take care of our patients and to also benefit by it. So, being that treating occlusal disease is so important and we should all be doing it, why is it that so few dentists really are treating, diagnosing occlusal disease on every single one of our patients? Dr. Peter Dawson and Dr. Pankey believe that very, very few people are really qualified to diagnose and treat occlusal disease. And this really points out to the fact that there is a very ineffective paradigm in education of occlusion. The education that we get in dental school is pretty minimum, and out there, the systems to treat occlusal disease and to diagnose occlusal disease seems to be too complicated and not allow for the great vast majority of dentists to really deal with occlusal disease. And for that reason, the occlusal disease management system was developed. This is a very methodic system that allows a dentist to first diagnose occlusal disease on every single one of his patients without becoming a big burden. It also allows for simple diagnosis, and then for education of our patients, because most of our patients do not even know what occlusal disease is. So the first stage of the occlusal disease diagnosis system is to, on every single one of our patients, do a discovery. In other words, do an occlusal diagnosis that will allow us to find out if the patient actually has occlusal disease. After we do that, then we can educate our patients and moving forward into the advanced diagnosis. I like to call the first diagnosis a screening or occlusal screening. It shouldn't take very long, because if it takes very long, then we're going to find ourselves having a hard time doing it. So it should be simple. Our team, our dental team, dental auxiliary team, is really in charge of educating and motivating our patients. They should spend a certain amount of time educating our patients about occlusal disease, in addition to certainly the other diseases that affect our patients' dentition. Then they are in charge of taking the necessary records, which are incredibly important, in preparation for us to do a comprehensive examination as we do routinely. The next step would be to have a conversation with our patient about their dental history. I find this very useful in order to get to know the patient's dental IQ and really get to know if the patient has some symptoms already that they are aware of. Some of the questions that we have on this dental history form, which you can see here on the screen, and you certainly are welcome to download the original so you can use it in your practice. These questions are very, very useful. Some of those questions include, are you aware or have you ever suffered from bruxism or grinding? And if the patient says yes, then that should be a clue that they are aware that there's a problem with their bite. Then another question is, do you have jaw pain, or have you ever had jaw pain or TMJ pain? And that is another clue that allows us to ask further questions and get to know if the patient already understands some of their problems. Another question is, do you have migraines and headaches? And that could also give us an opportunity to learn more about our patients' knowledge about their occlusion. One final question that is also useful in regards to occlusion is, have you had or do you have tooth sensitivity to hot and cold? That's a very important question. We need to know if the patient has this type of sensitivity, because it is very common for patients with occlusal disease to have a tooth sensitivity. Once we are finished reviewing the patient's dental history with the patient, then we are ready to do our comprehensive examination. And as you know, comprehensive examination should include the diagnosis of caries, the diagnosis of periodontal disease, and certainly the diagnosis of occlusal disease, because those three are the three main enemies of teeth. I have been telling you that diagnosing occlusal disease has to be simple and cannot take very long, because if it does, then we're not going to be able to implement it on every single one of our patients. So how do we do that? How do we diagnose occlusal disease? Well, we already started diagnosing occlusal disease, because when we went over the dental history, we looked at some of those questions are specifically targeted, so we can start finding out if the patient is aware that they have certain signs and symptoms of occlusal disease. And sometimes when we discuss the symptoms with the patients, they are surprised that this is even related to their bite. So there are 7 signs and symptoms of occlusal disease. If the patient has any of this or suffers from any of these signs or symptoms, then they do have occlusal disease at a certain degree. And assessing these signs and symptoms is actually quite simple. So let's go over them so then we can understand, and you will see how uncomplicated this really is. The first sign and symptom, in this particular case as a sign of occlusal disease, is pathological tooth wear, chipping, and fractures of teeth. So this is pretty simple for us to assess. We only need to look at our patient's teeth, and we can see if the patient's teeth are worn beyond the point that they should be. We can also assess if there is chipping and fractures on the fillings, restorations, or on the teeth. If we see these things, we should immediately realize that this patient is suffering from a pathological occlusal problem. The next sign of occlusal disease, and actually is a symptom, is tooth hypersensitivity. And this is a little bit less well known. Do you know that the great majority of the patients who suffer tooth hypersensitivity is related to occlusal disease? In other words, those patients who come to our practice and tells us that they have sensitivity with hot and cold, they have sensitivity when they eat ice cream, and sometimes they feel that the sensitivity is in one side at one point and the other side in another time. Those patients usually are suffering from occlusal disease. And this was clearly established by Dr. Tom Coleman, who did a very interesting study showing that when using different modalities to treat tooth hypersensitivity or cervical hypersensitivity, the only modality that always gave permanent relief was an occlusal equilibration of the affected tooth or of the entire dentition. This is a very important situation because how many times have you had patients who come to your practice, like the one that we see right here in this slide, who comes to your practice and tell you that they have severe pain on a tooth, and we can't see anything. We can't see caries, we can't see any apical problem, and we're just wondering, what could it be? Why is causing the pain on this patient? And the first thought that you should have is an occlusal problem. This patient in particular couldn't even open her mouth. The air would hurt her tooth, her first molar, in an incredible way. If you look at the picture to the left, you will see that her centric stops seem to be normal. Everything seemed to be even and on the centric stops. But when you look at the picture to the right, when the patient started, when we checked the lateral movements on the patient, we realized that this patient had lateral interferences. And after I removed those interferences, the sensitivity went away almost immediately. By the next day, and then the second day when I saw the patient, the pain, all that sensitivity was completely gone. And this has been my experience almost every single time. Because as you know, patients don't chew up and down like alligators. Patients actually chew and they swing their mandibles right and left when they chew. And it is very important that we always assess not only the centric occlusion, but also the lateral movements, so we make sure that they don't have interferences during the chewing movement. The next sign of occlusal disease is tooth hypermobility. Have you ever noticed that when you do your initial examination on some patients, you find that some teeth have a lot of mobility, and as you look at the x-ray, it is a little confusing because you see that there is sufficient amount of bone for the tooth to be stable. That immediately should trigger a thought that this tooth has occlusal trauma. And as we said earlier, sometimes that occlusal trauma is not on centric bite, but in lateral movements. There's an interference that is causing the tooth to become loose. So this is something that we need to keep an eye on. The next sign of occlusal disease is fremitus. Fremitus is a vibration of usually the anterior teeth caused by an insufficient amount of overjet and violation of the envelope of function. It is easy to test. We put our fingers on top of the teeth and we ask the patient to tap, and then we can feel the vibration. If there is vibration on any of those teeth, that would be a sign that there is envelope of function violation. And if that's the case, then that should let us know that there is other signs that usually are associated with fremitus. The next sign of occlusal disease is abfractions. Now, abfractions are one of those very controversial subjects, but from my clinical perspective, and there's plenty of research in this, abfractions are caused by mechanical damage due to the flexion of teeth due to usually lateral interferences. And I have hundreds of photos showing the consistency of abfractions and occlusal trauma. Unfortunately, some clinicians, including Dr. Peter Dawson, have denied the existence of abfractions. Nevertheless, research shows that abfractions can be reproduced in the laboratory, and without a doubt there is a need to have some acidic environment, which the mouth usually has an acidic environment. And when there is traumatic lateral interferences, that can form those abfractions. So it is one of the signs of occlusal disease. The next sign of occlusal disease is severe localized bone destruction secondary to periodontal disease. And this is what I was telling you earlier. When we have tooth hypermobility due to occlusal trauma, and that combined with periodontal disease, the consequence is very dramatic. The amount of bone loss, and there's good research on this as well, the amount of bone loss increases rapidly when there is mobility and periodontal disease together. So this is one more example where treating occlusal disease will actually prevent the loss of teeth, and it will lead our patients to have a healthier, longer dental life. Finally, the last symptom of occlusal disease is pain. And I have actually put it at the end because pain, although it's a very dramatic sign of occlusal disease, it is not the only one as we can see so far. There are some and many signs of occlusal disease. They are very, very serious. They're very, very destructive. They're very traumatic for our patients in addition of pain. But traditionally, pain has been the main sign that everybody thinks about when we think about occlusal problems, occlusal dysfunction. But certainly occlusal disease will cause pain. Most of the times, fortunately, it's muscle pain that can be easily treated with a proper occlusal equilibration, occlusal therapy of the different types. And occasionally, some of the pain comes from the actual joint. And in those situations, then treating pain becomes a lot more difficult. In order for us to assess which type of pain it is, the phase 2 diagnosis is indispensable. And with proper phase 2 diagnosis, we can easily assess whether the pain is coming from the joint or is a muscle pain. So that's it. Those are the 7 signs and symptoms of occlusal disease. They are not difficult to assess. If we look and we ask a few questions, within usually 3 to 5 minutes, we can assess if our patient has occlusal disease, educate and motivate the patient so they understand that some of those symptoms that they have are actually caused by their occlusion. And now it is the time to allow the patient to make some choices. We can certainly offer our patient to provide them with the basic dental treatment that they need, maybe treatment of periodontal disease, broken fillings, and other things that they might have, main concerns. But we should also offer the patient to treat the occlusal disease. And as we know, in order for us to treat occlusal disease, we would need to actually do a more comprehensive occlusal and TMJ examination, which is phase 2. So far, we have finished the stage 1 of the occlusal disease diagnosis system. Now we are able to assess that the patient has occlusal disease. If the patient refuses to have occlusal treatment in the advanced evaluation, that's okay because we have already done our part. We have allowed the patient to know that they do have a disease that is destroying their teeth. We have planted a seed on the patient's mind, and now they understand that sometimes even if some of our restorations have a shorter life, it's due to their problem, to their occlusal disease. So it has a lot of important advantages that we inform our patient. It is the ethical thing to do, to let the patient know they have a disease, even if they choose not to treat it. I strongly encourage you to make sure that your team is involved in the education and that you have some good educational materials like occlusal disease brochure to be able to get the patients to understand their problem. Now, just because the patient refused a little more advanced occlusal diagnosis and treatment, it doesn't mean that we cannot do anything for them. We still have one means to help them, and that is a night guard. A night guard is the most basic prevention that we have for occlusal disease. If a patient has any signs or symptoms of the 7 signs or symptoms that we discussed, a night guard is going to be helpful for them. It's not going to reverse the disease, it's not going to stop the disease, but it's going to allow for some protection and fast damage. And my experience is that when we place a night guard on our patients, a lot of those symptoms actually improve quite dramatically. And although a night guard will be helpful, but our ultimate goal should be to educate and motivate the patient so they actually go through with the ideal treatment, which that would be the advanced occlusal and TMJ examination, which will allow us to really get to the bottom of the problem, find out if there is occlusal trauma, if there is a lack of envelope, lack of overjet causing an envelope of function violation, or what is the cause of the occlusal problem. My experience is a night guard will be a very limited help because the patients destroyed and damaged their teeth throughout the day. And only by giving the patients a nice balanced bite can we give the patients health in their occlusion. Additionally, we want to remember that if we are considering any type of restorative work, extensive restorative work, we must assess the occlusal health of that dentition because, as we said earlier, the main reason why our restorations fail and break and have problems with whether it's veneers or porcelain restorations in the posterior area of the mouth, it is the occlusion that causes the problems. So I would never start any extensive restorative treatment without stage 2 occlusal and TMJ analysis evaluation. It is indispensable. The occlusal and TMJ examination includes a series of records which are indispensable for us to do proper diagnosis. And one of those records, without a doubt, is mounted cast utilizing the proper CR bite. I would encourage you to look at some of our other videos. We have a video that talks about the team-driven record-taking visit, and then talks about that clinical examination, or shows a video of the actual procedure being performed. And I'm sure that will be very helpful to better understand the occlusal disease management system and the methodic, organized, step-by-step process. And it will ultimately lead us to give our patients better dentistry, healthier dental life, and a relief of the signs and symptoms of occlusal disease. It's really been a pleasure. Thank you very much.
Instructions to obtain CE credits. Please click on the button titled CE Quiz to the right of the video start button. Print out the PDF quiz and complete. Please be sure to complete your participant information fully, as it is needed by the AGD to grant CE credits. After completing the CE quiz, please mail to the address listed on the form or scan and return by email to the email address listed. Please allow 4 to 6 weeks from the mailing time to receive your CE quiz score, along with your CE credit and certificate of completion.